So hello everyone, welcome to the panel from IMPROVA. So it is the first panel of the project. We'll be talking about why are we here, what are we doing, challenges which are ahead of us. And I would like to introduce my partners here. So let's start from Julian.
Hello, I'm Julian Carroll. I'm here from Autoliv Research in Sweden.
Hello, Eva. I'm from ITS from Poland.
I am Francisco López Valdés. I work for Universidad Pontificia Comillas in Madrid, Spain.
So I'm Simona Roca. I'm from IDIADA and Catalunya.
Hello, David Hind, and I'm from TRL in the UK.
Hello, I'm Albin Chanav, working at César in France.
Good. So before we jump into the detailed questions for each of you, maybe we can start a little bit with the generic questions. So why are we here? Basically, what are we doing? Why are we tackling the topic of long-term consequences?
It's great to be able to pick that up first. So for Autoliv, we've been talking about long-term consequences following road traffic crashes for a long time now. And there have been some initiatives to figure out how to investigate this and what safety system concepts might work to help with it. But we haven't yet come to a definitive point on which is the best way to point towards that in the future and come up with countermeasures. So we're here to work with the research community and find the answers.
Good, thank you. Yeah, I think it's very important to say that we have also industry representatives from psychological point of view, researchers, universities, etc. So yeah, maybe from the psychology point of view, what is the novelty, what is the new thing which we are tackling?
Yes, this is a very good question because many car accidents, when we collected the data, they are connected only to the physical injuries or crashes, car damage and that kind of things. And nobody says about psychological way and psychological mental health damage. So that's why I'm here.
Good, thank you. Are we first ones who are looking at the long-term consequences, Albin?
In this deep, yes. And I see the benefits of a project as delivering a kind of a standard so that it would allow us to enlarge our data collection and our data, generally speaking.
So David, for you in UK, what are you missing for having LTCs in your data, trauma register, data collection?
Yeah, I think for me, that one of the big things for the IMPROVA project is to be able to look at the injuries with long-term consequences and understand how we can measure those over time and prioritize the injuries that we're going to try and reduce in the future and make sure that we reduce the injuries that have the biggest impact on people and the biggest cost for society.
I have several questions, like very detailed to each of you. So from the industry point of view, from the research, so maybe start with the research until we go to industry, which is probably the last part, how to mitigate them. So from the research point of view, what are the main challenges facing? So we are 1 year already in the project. What have you faced as a challenge as a researcher?
I would say the two main challenges were, on one hand, the volume and the diversity of the literature, and on the other hand, the heterogeneity of the scales, of the long-term consequences scales that we studied. Because first, so the volume, the search yielded about 31,000 papers dealing with physical long-term consequences and about 14,000 papers dealing with psychological long-term consequences. So it is huge. And so for the heterogeneity of the scales, each and every study had a different structure, a different outcome, a different scope, of course, and it was then difficult to integrate them and have comparisons.
Perhaps one interesting point is that one of the main discussions is how much long is long, right? That we found some scales that look at long-term consequences after 3 years of the event, right? Others that start counting after 1 year, others it is 6 months. So even to get to an exact definition of what a long-term consequence is, it required a lot of effort and reviewing many papers. And we need to come up with a proposal. It's not that something that is completely set in stone, right?
So what is the method for what did you use as a method to choose the scale if there is one chosen? What to choose the time span for the long term?
That's I don't have an answer yet for that, but reflecting and this is more applicable to the physical long-term consequences, right? But I think after I don't know how many years trying to improve traffic safety, in general, in Europe and in other countries, we've gotten to this point in which we know well how to prevent many fatalities and many severe injuries. But when you start going down the scale of lower and lower severity, we don't know that much about it. And if you are considering injuries of a very low severity, but that can have long-term consequences, then the unknowns are incredible, right? So going back to David's point, for how much time do we need to consider for something to be considered long-term? I've no idea right now because we don't have records. We don't have enough information, and the heterogeneity of the studies is impressive, as Alvin was saying. So and now I'm going to try to give you a more specific answer. So it is, to me, as researchers, there is not enough time within our project to really have a final answer for that, but we need to contribute to advance the knowledge. So we are seeing that many studies are considering 1 year as a reasonable approach to it, and we are seeing if that matches what we are seeing in real-world collisions. So, but I cannot give you a better answer yet.
Yeah, I
don't
think
know if you
here
have.
also is important to say that it is not only us who are dealing with the topic. From the network we have created, we have medical experts, psychological experts. We have a lot of people who are dealing with these things hands-on with the patients. So they're also giving us a little bit indications, right? But ultimately we want to have something practical, something which can be used for industry to be applicable to design the final product for people, to mitigate a little bit the injuries which are dealing with leading to the long-term consequences.
And if I may, maybe I would also answer based on the report we already submitted, that we use a special methodology. We use the PICO framework, so that it allowed us to reduce and to go through the literature with a very evidence-based in the literature, like a very evidence-based method, to filter and only keep the high relevance studies.
And we also have a classification. For example, in a psychological way, we can talk about prolonged depression or prolonged PTSD, or we can also ask a person, what does it mean for you, long-term consequences? And this is also can be a measurement test, yeah.
So if we would have something already practical, so that's the hope and that's the goal of IMPROVA at the end, to have something very tangible. How would you use it in your case? What is your opinion?
Yeah, I think we need to find a way of measuring the long-term consequences, identifying which sort of injuries are most important to look at, how much impairment is actually important to try and reduce. So we've done work in the past looking at foot and ankle injuries, and they can have a major impact on a person's mobility, ability to stand. Those might change the job that you have to do. They might change your leisure activities. They can have a really big impact on a person. We might have a change in mobility of a little finger, and that maybe is not the highest priority. So we've got some decisions to make on the amount of impairment that we need to try and deal with as well.
Yeah, I think it's very good that you pointed out the injury of the finger, because I think from Autoliv or the industry partners we have in the consortia, this is not the injury or this is not the body region you would look at if designing your products, right? So what are the challenges? What is important for you from the industry point of view?
Yeah, and I think you're absolutely right. So a challenge is what's the safety need? How do we formulate the safety need in an appropriate way? Because that then allows industry to think about the right countermeasures. And so I think with every challenge like that, there is some kind of opportunity. It might take some innovative step to move forward with a new injury that we've got to focus on, but it gives the right challenge to do that. But I would say the big opportunity from my point of view is about the awareness. And so I think we've heard an answer to the question of who cares? Who cares what we do here? And it's a point of view from the person who's got the injury. They obviously care. It's important to the people around them who look after them, their friends and their family. Their lives are also affected. Society cares. The caregivers throughout society and the costs. But that's not really enough yet for industry in some ways. So we want to do the right thing, of course we do. But we also need the market to open up so that not only the people who are selling the systems can offer a countermeasure, but those who want to buy it are also care about this. And we need the alignment across the industry so that what's being offered is also being accepted and given out to the people where it can make the difference.
So building up on that, and going back to which are the challenges, I think developing the right tools or assessment methods, that's a real challenge right now, because we know the limitations of crash test dummies, even to predict injuries that are severe, and we don't know how to address these other perhaps minor severity injuries posing a high risk of long-term impairment. And one thing I like, at least from the project, is that we are looking into using human body models to try to help us in the assessment of these injuries, which is in itself a challenge, but we're trying to push the field, right, to do better. So that's...
Yeah, I think it's important also the resulting effect of these kind of things like a panel. It is to bring awareness to the topic. So that's why we are here, explaining what we are doing, but also bringing the challenges. It is not always everything happy and easy. So we are facing in the first 12, 13 months a lot of things.
Moment in which we discovered that we had 20,000 papers to review, it wasn't a happy moment.
Exactly.
No.
And then having hundreds of scales and to choose one. I mean, those are all the very challenging things which we need to overcome, and to choose one or two, in this case one for also for psychological. So yeah, I mean, there are a lot of challenges in the project. So I imagine a little bit the story of a person having injury, having tools. We have a scale, we have, let's say, protocols based on which the final design or final product is being designed. But obviously we will not be able to prevent every injury, not be able to prevent every long-term consequence. So Eva, what are we doing in IMPROVA for the post-crash care? So can you explain us a little bit more about this topic?
In psychological way, we can say that we really want to learn some, for example, rescue teams or medical centers or clinical centers, policemen, etc. We want them to know that the human body, this is not only bones and body, but this is human is also mental thing, mental creature, and everyone needs that kind of care, especially at the first aid, at the first moment of the accident, when we will taking care of this person. At the first moment of the accident, it will be a very good thing to decrease for example, PTSD symptoms or depression symptoms, or we can make this person get health much faster.
And how do you know that the person is suffering this kind of injury?
We have some scales, we have some classification, but when you are looking for the person who is a victim of a car accident, you can say that this person changed. And we can see it at their behavior, their people connection. We can see it in every step, every word the person says about the world. Because word itself doesn't change, but there is a very big change about thinking about this word. So from this moment, I think about this word, it's unsafe, it's not good. And driving is not that safe like I thought before.
I think it's a very good point of view because mainly for engineers and researchers, like 90% of the consortia, we were not aware of the psychological aspect and what can we suffer being or seeing the accident. So,
But you all have emotions, yeah?
hopefully, yes.
Yeah.
Do you think, David, that we could, or you could, in databases and registers somehow apply the psychological issue? Could it be in future used to also evaluate this?
Yes, I think one of the challenges we've seen already in the project is different countries recording different information about people who have been involved in collisions, and whether that's physical injury or psychological consequences. Recording things in different way, measuring things in different way, and we need across Europe some kind of consistent way of understanding that, and therefore being able to track that over time. So I think it's, that's going to be one of the key outputs from the project is a recommendation in how we can do that for the longer term.
Yeah, I think from the end of the project point of view, we ultimately want to, let's say, not only go to the zero fatalities and halving the serious injuries by 2030, which is the goal of the European Commission. But we have created during the first sessions, I think we had together kind of, someone said vision beyond zero, which was very, very nice, and it was something new, and we were all like, oh, we might use it as a motto of the project. So Albin, maybe can you share with us a little bit of your view on what is behind the zero? So why we chosen vision beyond zero? What does it mean for us, for IMPROVA?
It's not only about respecting the European Commission goals. It's really about saving lives and provide and ensure support a safe mobility for everyone, independently of your road user status, if you're a pedestrian or if you sit in a car, and even with some new developments like the mobility transition and the ecological transition as well, which also play its role. So yes, it's really about how the community itself goes to the goal of providing a safe environment.
Yeah, I think for the first 12 months we have shared our challenges, our opportunities, and probably we will be doing this panel also with different partners in future, sharing already some results. So now we are in very decision state of the project. So I would like to thank you all. Thank you for being able to help us understand IMPROVA, what are our goals, visions, and see you in the next panels.
Thank you.
Thank you.
Thank you so much.